Hello everyone. So today I'm going to discuss suicide risk assessment with you. So assessment is something that is done in the hospital in patient who presents with attempted suicide. Okay. First they are medically managed. After they are declared medically stable and safe, then a member of the crisis team from the psychiatry department talk to this patient and try to assess their suicide risk for future, and they try to classify whether the patient is high risk for another suicide or low risk for another suicide. So if the patient is high risk, then they will keep the patient in the hospital, and if he's low risk, then the management will depend upon that. Okay. Now, suicide risk assessment is something that we also do briefly in other psychiatry cases, like, for example, patient with depression, patient with insomnia, patient with eating disorder. But in those cases where the patient has not yet attempted a suicide, we just briefly ask few questions to ascertain whether the patient is at risk of self-harm or not. But in those patients who have already attempted a suicide, we do a thorough assessment because the strongest risk factor for a suicide is a previous suicide attempt. Okay. Now, when you enter the cubicle and you start talking to a patient who has just tried to take his own life, it's not going to be easy. You cannot get away by asking something like, "How may I help you?" Okay, these patients will not talk like that easily. They will be very reluctant, very hesitant, maybe they have a low mood or something. So you have to be very patient and empathetic here. Okay. So you will start with something like, "I understand that you have taken quite a lot of pills, or you have tried to cut yourself." Whatever the mode of attempted suicide was, you will start with that. Okay. So I understand you have taken quite a lot of pill, or you tried to cut yourself. Can you please walk me through what has happened? Okay. Can you please walk me through what has happened? So then they will tell you kind of the whole story that of the event that has happened, but they might stay quiet for some time after that. So you cannot rush these patients. Okay. You can just ask a few, you can just say a few sentences like, "Is it difficult to talk about? It's okay, I'm here to help you." All right. Give some time to the patient to open up. Okay, if the patient has presented with taking some pills, then ask briefly about the pills. "Can you please tell me the name of the pills? How many did you took? When was that?" Okay. And then so now we will, you know want to know the state of mind of the patient. Okay, whether he really meant to commit the suicide. Okay, so those patients who are serious in their suicide attempt, they try to make sure that no one else is around when they are doing it. They have planned it for some time. Okay, some patient might take annual leave so that they are not people at work might not notice that they are missing. Okay, they will make sure that they are alone in the house. It will be premeditated, pre-planned. All right. So these patients are high risk for suicide, where some patient can be just impulsive and do it in the spur of the moment, and those patients are low risk for suicide. So now we really want to know the state of mind of the patient. So we will ask, "May I ask what was going through your mind at that moment?" Okay, was it something that you were planning for some time, or did you do that impulsively in the spur of the moment? Okay, was there anyone around at that time? What are your hopes and plans for the future? Now, this question is also very important. Someone who is clearly depressed and suicidal, they will have no hopes and no plans for the future. They will say, "Doctor, future doesn't interest me. I don't think there is anything in the future. I can see nothing in the future." Okay. But patients who are low risk for suicide, they might say, so I will go home and I will cook myself a meal, or I will go to the gym or something like that. So they will have some plan, even some little plan. Even if they tell you, "I'm going home and I will call one of my friends," this is still hope. Okay. Those who are high risk, they have just no hope for the future. They don't want to do anything. They don't want to talk to anyone. Okay. Also, this question, "What will you do differently in future if you face a similar situation?" Okay. Then risk factors for suicide. So we'll ask about some risk factors. So basically, depression is a risk factor. So we'll say, "How has your mood been recently?" Okay. If the mood is low, then we will take a bit of the depression history. We'll explore the low mood. Okay. How would you describe your relationship with your partner? Okay. Another very important question, relationship with the partner. Please explore if the relationship is abusive. Okay. How about your friends and family? Are they supportive? What do you do for a living? How is everything at school and at work? Any alcohol and drugs. So all of these are risk factor for suicide, low mood, in a bad relationship, non-supportive friends and family. Um, Nothing is good at work or at school, failing at school, bullying at school, and a positive history of taking alcohol or recreational drugs. Okay, then we will ask about the past psychiatric and the medical history. We are not asking famish here because most of the question of famish we have covered either in the risk taking, in the risk factors part, or in the exploring the symptom part. Okay, so past psychiatric and past medical history would be enough. Still, if something is remaining out of the famish, then you can ask here. Okay. So management will depend upon what we find out in the history. So if we find out the patient is high risk, then we'll tell the patient, I'm sorry for what you've been going through. While we cannot change what has happened, we can certainly discuss how can we help you in the future. Okay. So a high risk patient, we will tell him, unfortunately, your mood is very low and you are going through a difficult time at the moment. So we will like to keep you in the hospital for some time for us to be in a better position to help you. Okay. Don't say, is that okay with you? Okay. Even if he's not okay with it, we will still keep him in the hospital against his will. Okay. Because patient is actually suicidal. You will say, I'll inform my senior and we'll give you some medication and we'll also arrange talking therapy for you. If the risk is low, the patient was impulsive, he maybe he was just been through a fight with his partner or with his family or someone, and he was impulsive and he did suicide and tried to do suicide in the spur of the moment, but now he's feeling guilty about it and he is positive about the future. So you will just tell him, as your mood is good and you are feeling well, you should be able to go home. Let me just discuss it with my senior. So a patient who did impulsive suicide attempt with plans and hopes for the future, okay, and is feeling guilty about the suicide and his mood is not low, there is no past psychiatric history, you'll just discharge this patient after discussion with the senior. Even no need for future follow-up. Just safety net that if you ever feel that your mood is low, then just if your mood is low or you are overwhelmed, we will give you a crisis card and there's a number on it and you can call and there will be someone to help you. Okay, so that was all about suicide risk assessment, and I will see you soon with another video.